Are you finding yourself forgetting things more often lately? Have you misplaced your keys more than once this week, or struggled to recall the name of someone you met recently? You may wonder if this is just aging or something more serious. It's important to pay attention to these changes because they could be early signs of dementia. You might think you're too young, but signs of dementia can start decades before. Do you know that normal forgetfulness and dementia are totally different things? More than 55 million people worldwide are affected by dementia, and this number is on the rise, especially in the United States. As of 2024, approximately 7 million Americans aged 65 and older are living with Alzheimer's disease, a figure that is projected to nearly double to 13 million by 2050 if no new preventive or curative measures are developed. As you can imagine, the cost of this to the healthcare system is incredibly expensive. Alzheimer's disease accounts for 60 to 70% of dementia cases, followed by vascular dementia, which accounts for 20% of cases. Have you seen any other types of dementia? Mention in the comment section below. Dementia does not discriminate. Actors like Bruce Willis and Robin Williams are among many stars who suffered from dementia, but the average population suffers greatly too. We all know someone who is affected, but it's not just the person who has the illness. It's the family and caregivers that have to look after and see what this disease does to their loved one, which can greatly impact any person. Do you know anyone around you who has shown signs of persistent memory loss? If yes, seek medical advice immediately, as they might be suffering from dementia. Early recognition of these symptoms can have a significant impact on treating this disease. In this video, we will outline symptoms of dementia that are mostly silent and not given much attention in the early stages. So, like this video and share it with your friends and family to spread awareness. Let's get started. Sign 1: memory loss. So how is dementia different from normal forgetfulness? We all forget things from time to time, like where we placed our keys or the name of a colleague. These lapses are often due to normal aging or busy lives. In normal aging, while we might forget details, we can usually recall them later, and our ability to function daily remains intact. In contrast, dementia involves a severe decline in cognitive function that interferes with daily life. Dementia is a neurodegenerative disease where neurons die at a faster rate than normal aging. This accelerated neuron death leads to significant brain damage. Therefore, dementia is not a part of normal aging. It's entirely possible to live past 100 years old with full cognitive function without losing your memory or track of things. For example, a person with dementia might remember how things were during the Second World War, but forget what they had for dinner last night. They may forget where they parked their vehicle or if they have already paid for their groceries or not. It can also be identified that they have difficulty finding the right words. Sometimes he may use a related word that is not exactly the right one, like using glass instead of cup. This difficulty is called aphasia. Many famous professionals were diagnosed with this unfortunate disease, leading them to the culmination of their career. American actor Bruce Willis was diagnosed with frontotemporal dementia at the age of 67, experiencing symptoms such as aphasia, behavioral changes, and cognitive decline. These symptoms affected his ability to communicate and perform, leading to his retirement from acting. In early symptoms of dementia, memory loss is the most significant, and recognizing it early is crucial, because memory loss becomes the base of every emerging issue in dementia and can disturb every aspect of life. If you notice consistent memory lapses, it might be time to seek medical advice. Timely intervention can significantly slow the disease's progression and improve quality of life. It can include lifestyle changes, medications, and therapies designed to support cognitive function. Sign 2: difficulty performing familiar tasks. Living with dementia presents significant challenges, not only for the individual affected, but also for their caregivers and loved ones. One of the most distressing aspects of dementia is its impact on everyday tasks that were once routine and familiar. Tasks like cooking a favorite recipe or managing finances become increasingly difficult as the condition progresses, leading to frustration and confusion. Imagine a scenario where a person with dementia attempts to cook a familiar recipe. Cooking, which used to be second nature, now become a complex and confusing task. The individual may struggle to follow the steps in order, forget crucial ingredients, or lose track of time altogether. Simple decisions, such as how much seasoning to add or when to turn off the stove, become daunting challenges. This difficulty arises from the cognitive impairments characteristic of dementia, such as memory loss, impaired judgment, and reduced problem-solving abilities. Furthermore, Managing finances poses another significant hurdle. Tasks that once involved calculating bills, managing budgets, or understanding financial statements now seem impossible. Individuals with dementia may forget to pay bills, struggle with basic arithmetic, or make poor financial decisions due to impaired judgment. They may also fall victim to scams or financial exploitation as they become increasingly vulnerable in managing their money. In both scenarios, the person with dementia experiences a loss of independence and confidence. The frustration of not being able to perform tasks that were once so familiar can lead to feelings of anxiety, depression, or agitation. Caregivers also face challenges, as they must balance respecting the individual's autonomy with ensuring their safety and well-being. Caregivers and family members can support individuals with dementia in several ways, like simplifying tasks and breaking them down into smaller steps to make them more manageable. Patience and understanding are crucial when interacting with someone with dementia. Encouraging independence where possible, while offering gentle guidance and supervision, can help maintain the person's dignity and self-esteem. By adapting to their changing abilities and needs, caregivers and loved ones can help create a supportive environment where the person with dementia can thrive as much as possible despite the challenges they face. Sign 3. Language problems. Dementia not only affects memory but also language and communication abilities, creating significant challenges for both individuals with the condition and their loved ones. What starts as occasional forgetfulness of words can escalate into a frustrating inability to follow conversations or express thoughts. Imagine a scenario where someone with dementia struggles to keep up with a conversation. They might initially forget a word or two, leading to pauses or substitutions that disrupt the flow of their speech. As the condition progresses, they may lose track of the topic altogether, resulting in confusion and frustration. This difficulty in following conversations often leads to social withdrawal, or the person unintentionally interrupting others to try to grasp what's being discussed. Moreover, repetition becomes another hallmark of communication challenges in dementia. The person may ask the same question multiple times, even right after receiving an answer. This repetition stems from their impaired ability to retain recent information, causing them to forget that they've already asked or received a response. Each time they ask, it's an attempt to make sense of the information or to connect with the conversation, despite the momentary nature of their memory. These struggles with language and communication can also affect social interactions and relationships. Conversations that were once enjoyable and meaningful may become strained. Family members and friends may find themselves repeating explanations or answers, which can lead to frustration. The person with dementia may feel isolated or misunderstood, as their ability to express themselves diminishes over time. Well, this inability to find the right words or maintain rational conversation can hurt self-confidence and independence. Because tasks that require verbal communication, such as ordering at a restaurant or participating in group activities, become difficult. This loss of communication skills can lead to increased social isolation and a sense of disconnection from others. Strategies such as speaking slowly and using simple language and allowing extra time for responses can help facilitate better understanding. Patience and empathy are essential when dealing with repetition. As dementia progresses, alternative forms of communication, such as nonverbal cues or using visual aids, may become more effective. Sign 4. Disorientation. Living with dementia turns daily life into a world of uncertainties, where the usual routines of time and activities become unclear. Imagine waking up and not knowing if it's morning or evening, or struggling to remember important appointments and when to take needed medications. This constant confusion disrupts daily life, causing anxiety and a deep sense of helplessness. Owing to this confusion, even simple tasks become difficult. Keys that were always kept in one place now seem to disappear, wallets hidden in random corners of the house, and phones might end up in the fridge. These are not just forgetful moments, but signs of cognitive decline. Other than that, moving around familiar faces and places becomes a confusing adventure. A routine walk to the neighboring market can turn into a confusing journey, and nothing seems familiar. More distressing is the loss of recognition within one's own home, a place that used to feel safe and warm. This disconnection raises fear and loneliness, not only for the person with dementia, but also for their caring family members. And that is not all. The challenges can be more than inconvenient. They can be dangerous. People with dementia might wander off, get lost, and be unable to find their way back home. They may overlook common hazards, increasing the risk of accidents. Families live with constant worry, always on alert to ensure the safety and well-being of their loved ones. But this situation demands that families come together in strong solidarity, proving that love and unwavering support can overcome the tough obstacles of memory loss. Sign 5. Poor judgment. Living with dementia brings profound changes to daily life, affecting decision-making, financial skills, and personal care. These challenges are more than just forgetfulness, as they significantly impact daily routines and safety. One of the most difficult aspects of dementia is impaired judgment. Individuals may struggle with simple decisions like what to wear or eat, and this can extend to more serious choices such as leaving home without telling anyone or forgetting to turn off appliances like stoves, posing risks of accidents or harm. This underscores the need for constant supervision and safety measures. Due to impaired judgment, financial management also becomes problematic. People with dementia may make poor financial decisions, overspend, or fall prey to scams due to a diminished understanding of money matters and increased vulnerability. Early financial planning and appointing a trusted person to manage finances are crucial safeguards. Furthermore, a visible decline can also be observed in personal grooming and hygiene. Tasks like bathing, brushing teeth, or dressing appropriately may be neglected, affecting both physical health and self-esteem. Approaching these challenges requires patience, empathy, and practical strategies. Managing finances involves early planning and legal considerations, such as setting up power of attorney and protecting against financial exploitation. Maintaining personal hygiene requires creating a comforting environment and offering gentle reminders and assistance while respecting dignity. By adapting strategies and providing compassionate care, caregivers and families can improve their quality of life and ensure safety amid the challenges posed by dementia. Sign 6. Changes in mood and personality. Mood swings and personality changes can also indicate dementia, affecting both individuals and their families. Recognizing these early signs is crucial for providing the right support and dealing with the challenges ahead. Apathy, also known as anhedonia in medical terms, often marks the beginning of dementia. People who used to enjoy activities like dancing or shopping may lose interest and start avoiding social events they once loved. These changes happen because the brain is going through a decline, affecting how emotions are managed. You might also notice shifts in mood. Someone cheerful before might become easily annoyed or feel sad most of the time, showing that their emotions are in turmoil. Anxiety and depression can also appear, making everyday interactions harder and leading to feelings of loneliness. As dementia gets worse, these personality changes can become more pronounced. Individuals might get more agitated, act impulsively, or become more suspicious and fearful. These changes can strain relationships and make it tough for caregivers who have to adjust to unpredictable behavior. Sometimes, dementia brings hallucinations, where people see, hear, smell, feel, or taste things that aren't real. This can be very distressing, like seeing someone who has passed away, or hearing voices when no one is around. Sleep problems are also common with dementia progression. Changes like more napping during the day, trouble sleeping at night, or vivid dreams can disrupt sleep patterns and affect overall well-being. To manage these symptoms, we will have to show a caring approach with practical strategies. Establishing a regular daily routine can provide stability and reduce stress. Encouraging gentle exercise and activities that match their abilities can help keep their mind active and improve their mood. In addition to that, communication should be clear and patient-focused. Simplifying instructions and minimizing distractions in their surroundings can help them understand better and reduce agitation. Medical treatments like medications for mood issues or hallucinations should be managed by healthcare professionals. Regular checkups can track how dementia is progressing and adjust treatment plans as needed. In the end, we are finally aware of the fact that memory loss may seem minor initially, but it progresses beyond normal aging. Signs include forgetting recent events and information, not recognizing familiar things, inability to communicate, disoriented lifestyle, poor judgments, and mood swings. For any symptoms like these, one should seek medical advice promptly. Early detection of these symptoms is critical, and it allows for medical intervention and lifestyle adjustments. Families can also support by using memory aids, maintaining routines, and seeking guidance from healthcare professionals. They should consider joining dementia support groups to navigate challenges and access further assistance. Other supportive strategies include simplifying tasks, providing clear communication, and ensuring a safe environment. By raising awareness and understanding the signs of dementia, we can better understand affected individuals and families, developing a compassionate and informed community. For more information, consider contacting local healthcare providers, dementia organizations, or support groups specializing in caregiving. Did you like the video? Remember to share it so more people have this knowledge. Remember to subscribe, and see you in the next video. Thank you very much.